An internal medicine physician who works as a hospitalist at Baptist Health Paducah knows what it's like to be on the front lines fighting COVID-19. News 3's Denise Turner is here tonight to tell us what Dr. Ben Thompson sees every day in the COVID unit.
Mark, Dr. Thompson shared with me some of his experiences, including how the virus even changed his bedside manner. Dr. Ben Thompson is an internal medicine physician who practices as a hospitalist at Baptist Health Paducah. He says he was the first doctor to admit a COVID patient to their facility back in March, and he's been caring for COVID patients since then. Dr. Thompson says their facility has 2 areas set up to treat patients with the virus.
We have one area that is an intensive care unit that has been carved out to manage COVID patients. There we have our sicker patients, the ones that are requiring much more oxygen, the ones that are on a ventilator.
The other unit is for patients who are not as ill but still need medical attention. One of the hardest changes as a hospitalist Dr. Thompson has to deal with is the manner in which he's able to communicate, console, and provide answers to patients and their family.
COVID has changed that. So a lot of my conversations now, when I'm talking with a family member, it may be a spouse, it may be a brother or a sister, I'm having those conversations on the phone where I can't see their face, I can't look at them eyeball to eyeball, nor can they really look at me.
Dr. Thompson says over time they have learned of regimens that help them treat the virus, but nothing is permanent.
We have some options. Remdesivir is a good option. Convalescent plasma is a good option. There's a steroid called Decadron that we administer that's a good option. But none of these regimens cure a patient with the virus.
Dr. Thompson says right now the best method available to the public in combating the virus is wearing the mask.
If they could suit up with me, go into some of these patients' rooms, and see everything that the physicians here who have been taking care of COVID since March, if they could see what we get to see and how this virus has impacted patients and their loved ones, I think they would understand the cry from the physicians to be more compliant with wearing the masks.
Now, Dr. Thompson says he understands people not wanting to wear masks, but says the job is not done and we must continue wearing them until it is. In studio, Denise Turner, News 3.